My name is Dr. Nidhi Saluja and I am working at Indira IVF Gurgaon as IVF Specialist and Center Head. So today we'll be discussing the topic, what are the causes of bleeding post-embryo transfer and what is its management. Around 25% of the patients complain of bleeding post-embryo transfer. Now what are the common causes? You should not panic. There are few common causes which can lead to bleeding. The first one is a difficult transfer. Sometimes during transfer, the doctor may require the use of some instruments. Such patients will complain of bleeding for a day or two. But the doctor usually informs them that it was a difficult transfer and then they can have a bleeding. Second cause is implantation bleeding. Around 6 to 10 days post-embryo transfer, a few patients have spotting or bleeding. This is because when the embryo gets implanted in the uterus, it will erode the lining of the endometrium, which can lead to spotting. It is very mild and settles in a day or two, but you should consult your doctor for this bleeding as well. This also does not mean that if you do not have implantation bleeding, you will not conceive. The third cause is decreased hormone levels. As we know that IVF is an artificial pregnancy and there are no natural hormones in the body to support pregnancy. So whatever hormones we give you from outside will only support pregnancy. In case the patient does not take these medicines properly or these hormone levels go down, they can have bleeding. So do not panic. First, apply a panty liner or a sanitary napkin to quantify the amount of bleeding. Secondly, you consult your doctor, who will advise you an additional hormones in the form of injections or medicines. These hormones are to increase your progesterone levels, which will support the pregnancy. Third, you should not exert and take an additional rest. Any kind of travel should be avoided. Another cause is the local cause, like any polyp on the mouth of cervix or during pregnancy where the cervix becomes raw. So in case the patient performs a sexual intercourse, it can again start bleeding. So usually the doctors advise that sexual intercourse should be avoided from the day of embryo transfer till around 8 weeks of pregnancy. Another cause can be an ectopic pregnancy. Although the incidence of ectopic pregnancy is very low in IVF, but it is not uncommon. Ectopic pregnancy actually means that the embryo gets implanted in the place other than uterus. That is, it can be tubes or it can be the cervix. So such patients can have bleeding off and on in spite of taking high progesterone. So you can consult your doctor and get an early ultrasound done to confirm the site of pregnancy. So these are the common causes which can lead to bleeding post-embryo transfer. The first thing is, do not panic, consult your doctor and take an appropriate treatment. All the best. Thank you.